this Ramadan.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Welcome back. We're on to the final interview for the morning. It is exactly 12:42. And we have Riyaaz Khan, who is a corporate trainer at Tibb Health Sciences. We're going to be talking about the wonders of Tibb black seed. Alhamdulillah. And I can't wait to get talking. And I see the tagline for today's interview is Detox, Digest, and Defend. Assalamu alaikum to you, Riyaaz Khan. Welcome to the program.
Oh, wa alaikum salam.
So
Thank you so much for
obviously, nice to have you on the show. Obviously, with this type of a regime, Detox, Digest, and Defend, you are really saying that that's going to ensure good gut health. And if you take the right supplements, perhaps, or the right type of alternative medication, you could ensure a real long, healthy lifestyle.
100%. Just to correct you there, we won't really be talking so much about black seed today. I think that was covered in a previous interview. Today we're going to be talking about digestive health, liver health, as well as your immunity and how it's linked to digestive health with a few products from Tibb.
So I think I was a bit confused, Riyaaz. I kind of assumed that, and please correct me, I probably am off track completely here. I assumed that black seed was possibly the key ingredient in all of your products.
No, black seed is actually one of our products that we have, and obviously we know of one of all the different amazing benefits that you can get from it. And actually, one of the major benefits that you get from taking black seed is the fact that it works as a gastroprotective product, where it helps to alleviate some digestive distress. But then, as a very powerful antioxidant as well as an anti-inflammatory, you'll find that the diet that we consume these days is actually very pro-inflammatory. And that's where people generally struggle with all the issues internally, like the gas, the bloating, the joint pains and everything. And it's weird that sometimes you'll find that joint pain is actually comes from digestive issues.
Sure. Absolutely. Everything is interlinked, and we don't apply our minds to all of those issues. And you're right. The type of diets we have these days is not doing us any good. We overindulge in really all the different and all the bad stuff. We think, we're having a great time when we go out and have these huge meals with friends and family, but not realizing what we're stuffing ourselves with and how much of damage it's doing to our gut and our overall health and well-being. Would I then be correct in focusing on a liver Tibb, one of the products,
Correct, yes.
Gastrone, and also Septogard? Are those the three products we're going to be talking about today?
Yes, those are the ones that we're talking about today. And the first point, obviously, is in terms of the liver Tibb, right? The liver Tibb is a product that we have that is there to help assist in the functioning of the liver. To take it a step back, we need to understand what the function of the liver is. And its major function is digestive as well as detoxing the body. Now, if we look at the current month that we're in, where all Muslims are fasting for the entire month, that in itself is a major detox as well. But there is
the big but.
But the big but. So there comes a time where it's time for iftar, and we kind of undo all the goodness that we did in the day. And as a result, that large meal or that continuous eating throughout the evening puts a lot of stress on the digestive system, and then in turn the liver and all of that as well.
So I know we eat lots of fatty foods, pies, samosas, lots of sugary stuff, the milkshakes and everything else that goes with it. And then, of course, yes, you are right. We feel very bloated. We feel uncomfortable, nauseous, and, the list just goes on. What would your recommendation then be? Do we start the liver Tibb how do we build ourselves up pre-Ramadan, or do you just take it as and when you feel bloated and gassy, etc.?
So the liver tip, like I said, it's there to help in assisting in liver function. So the liver is already doing the job. If you want, you can kind of consider the liver as the body's punching bag, where it works throughout the day, and then while we're asleep, it recovers at night, only for us to damage it again the next day or to overload it with work the next day. And as a result, we find that sometimes the liver isn't able to do its job and aid in the digestion process the way it's meant to. And even if you look at, even if let's just use Ramadan right now, because this is where we are, right? You'll find that we eat a certain way for 11 months out of the 12 months. This 1 month, everything goes out the window. You already mentioned all the really dense foods that we eat, the pies, the pastries, and all of that. And that having that rapid change or that serious of a change to your diet for this 1 month actually does cause digestive distress. So that's where all those issues come in. And the liver tip in conjunction with the gastron would work really well in terms of alleviating all digestive issues. So you're looking at gas, bloating, constipation, indigestion, acid reflux, as well as, to an extent, heartburn.
But I see also, very interestingly enough here, we focusing on Ramadan and why liver tip would be very helpful in Ramadan. Do you take it on a needs basis? And then that's question number one. And still on liver tip, what about people who have liver disorders like fatty liver, jaundice? There's also the issue around the side effects of other very toxic drugs like statins, chemotherapy, ARVs, etc., etc. How does that play a role?
So it plays a vital role. Liver tip, in terms of how we would use it as a detoxing agent, you could use it, ideally be on it every month. We'd love for you to be on it every month. But let's say you don't have any of those conditions. So you're not on chronic medication. You're not, you don't drink alcohol where there's a lot of toxins to remove and all of that. Then you could actually use it every second month or even once a quarter. Ideally, we would have loved to have everybody to have used liver tip at the beginning of Ramadan, because while you're detoxing your soul, detox the body as well. Okay. And then in terms of all those other side effects, again, it comes down to our diet. Can we really say that all the food we eat is 100% natural or organic? No, we can't. And then on top of that, you have everybody taking a lot of vitamins, which is also chemically made. And then you get the really strong medication like the ones you mentioned, your statins, your anti-inflammatories, all of those that can cause long-term damage. This would actually aid the liver in actually recovering, being able to perform function, improve its function, as well as getting back down to 100% of function in terms of being able to manage those those medications. Because remember, all of those medications are metabolized in the liver.
Okay, Riyaaz, I do know that you interact with medical practitioners on a very large scale regarding the different, because you are the trainer, the corporate trainer at Tibb. What do you suggest then in a situation like this? You're saying once a month, etc. How does one then, take this medication? Do I have to consult with my medical practitioner and say, all right, I'm perfectly healthy, I think. I don't have any of those conditions that I've just mentioned now, jaundice or whatever else. But I want to be healthy during Ramadan. I don't want to feel bloated and uncomfortable or gassy, etc., because it's very embarrassing. Can you suggest, as my medical practitioner, not you, Riyaaz, my medical practitioner, how do I take the medication? Or is it as simple as just going into a store, buying the liver tip, follow the directions at the back of the bottle, and I'm good to go?
So it could go both ways. If you want, you could just go into the store and get it. But if you are struggling with a condition like irritable bowel syndrome or leaky gut syndrome, where it's affecting your entire digestive process, it would be nice for you to talk to your practitioner as well. But generally, we find that even if a customer or patient goes in store and just purchases it off the shelf, they get really, really good results. Almost, I don't want to say almost immediately, but within a short space of time, yeah.
Okay, you preempted my next question. That was what I was going to ask. Immediately, or do you have to wait for a week or month? Do you have to take this for a certain period of time to see results?
So especially like with the gastrone, as you find that you will feel relief within the first day or two, let's say worst case scenario a week, because the herbs in there and the ingredients in there facilitate improved digestion and carbonative actions, which actually help to dissipate the gas within the system. So that will give you almost your immediate relief. Whereas with your liver, I mean, let's talk about the liver itself. When do we actually think about our liver and what it does for us? Very rarely. And the amount of damage done to the liver is also very rarely spoken about. And when we feel or when our liver is being damaged, we rarely feel those actual side effects. So similarly, you will find that during the recovery process, you may not feel a great immediate improvement in whatever you're feeling. For example, if you have fatty liver disease, that takes a while to get rid of. And then obviously using the liver Tibb, it will facilitate that, moving all of that out the system. So when we're damaging the liver, we don't feel the damage. So similarly with the healing, you don't necessarily feel it, but you will see signs. For example, you will find an increase in energy. You will find improved digestion. You will find your ability to handle certain foods or medication or your tolerance improve as well.
The all-important question then, Riyaaz, let's just to clear up any misconceptions. When one has one of these conditions, alcoholic liver disease, for example, anorexia, whatever it might be, liver damage due to radiation therapy, should you take this in conjunction with the meds prescribed by your medical practitioner? Or do you just stop taking the allopathic medication and go onto the liver Tibb or the gastrone and we'll get to gastrone and Septogard in a minute or two. What is the best practice here?
So I think the rule of thumb is if you've been prescribed something, you always have to include your practitioner in the decision. And I think very rarely would they pull you off the medication completely or cold turkey. So there may be a combination therapy initially. And we've actually had really good results with all of that. So for example, a cancer patient who's been on chemotherapy, they would use this in between their cycles. So either 6 to 8 week cycle of chemo and radiation, they would use this in between those. Because they generally get about a 4 week or 6 week break between their cycles. So this would be something to help them in between that. And then same with your patients with ARVs and all that. They can use it in conjunction with their medication. So far, we have not received any significant drug interactions where it's caused an adverse reaction or effect.
Oh, that's wonderful. Let's move on then. You did touch on gastrone, and I also spoke a lot about the bloating and the discomfort and, of course, flatulence, etc. This you have said that would give you possibly immediate, relief. People are in the habit of taking off the, over-the-counter meds for these type of discomforts, like those that they take. I'm not going to name them on air right now, but with the gastrone also, is it advised to take it on a regular basis? Because some people do have these problems continuously.
100%, yes. So gastrone is a product that is very unique in the sense that it can be used acutely or it can be used chronically. So if you invite me over to your house for Eid and we have a nice big meal together, and on my way home I'm feeling a little bit bloated and uncomfortable, I can have gastrone that evening, and by the morning or even a few hours later have relief. But then you have your patients who struggle with chronic digestive issues where they have intolerances, um, like we mentioned before, leaky gut syndrome or IBS. This is something that they can use on a regular basis to improve their actual digestive system. I mean, the herbs in here, it's actually very similar, or most of them is actually found in your kitchen cupboard. Um, so we've used them all here to improve your digestion, and then also contains prebiotics in here as well. Prebiotics are the food for your bacteria in your gut to actually eat, and your probiotics are the actual bacteria that we reintroduce into the area.
Okay, so pretty safe to take on a regular basis.
Yes. I mean, always speak to your pharmacist if not your practitioner, because that's my job. I go in and help them understand the products a bit better, so they would be best to chat about if you have any other conditions as well that you want to discuss.
Okay, let's talk about SeptoGuard. What is that all about, and how's that going to help us as opposed to other over-the-counter meds?
So the reason why I brought in SeptoGuard today is just because of this great link between gut health and immunity, or your immune system. You'll find that what people don't realize is 70 to 80% of your actual immune system resides in your gut. So when you have poor gut health, generally infections, or you're more likely to become sick and all of that. And if you go back to the very famous quote by Hippocrates, he says all disease begins in the gut. So so obviously there's a big link between the two, and Septogard works pretty much as your natural antibiotic or natural anti-infective, where it helps to fight off all your bacterial, viral infections, even some soft tissue infections like gum abscess and boils and all of those. So it works really well in terms of fighting infection in the body by assisting all those, or increasing immune system activity to get rid of all those foreign bacteria and particles. And I think it's quite pertinent we mention this right now, because we're going into this winter period where people are going to be getting sick. I mean, people have already been getting sick. And remember, every time we use antibiotics, they tend to lose a little bit of efficacy. And that's where your antibiotic resistance kicks in. Whereas you won't have any issues with that with regards to your Septogard. So you can use Septogard throughout the entire year, or during your periods of high infection, or when you're actually sick. So it works preventatively as well as therapeutically.
Okay, so when you talk about therapeutically, how so if I feel fluish, what's the
Yes.
Septogard going to do for me?
So it's number one, it's going to work as an immunostimulator, right? So that's where it's going to help to boost your immune system, or increase the strength of your immune system to be able to fight off that bacteria. And then you'll find the second benefit that we go into is that it works as an immunomodulator, a very strong immunomodulator. Now, immunomodulating basically means it's the body's ability to up and down regulate immune system activity. So you'll find that generally we get sick because of an inadequate response of the immune system. So a silly example, if our immune system is killing in 50 bacteria per day, and if we have 60 bacteria coming in, then obviously there's a surplus of bad bacteria. So that inadequate response generally leads to us being sick. And then obviously you have environmental factors, if somebody's sneezing around you and all of that type of thing.
Absolutely.
So
Okay,
you have,
so carry on.
yeah. And we have a powerful anti-inflammatory and with anti-allergy benefits in there. So all your people that are sneezing, your antihistamine benefits, are you going to get them in Septogard as well? And then it wouldn't be complete if we didn't contain vitamin C, and that's what we've got in there. So those are the main things that you're going to get out of your Septogard. So it's a very well-rounded immune booster, but also treatment option for colds and flus and all of that.
Okay, so pretty safe to take all year round because it's going to boost your immune system,
Correct.
hopefully. Oh,
Yes.
wonderful. Let's ask this question then, because I think it's important. lots of people all around the world pop lots of pills all of the time. We know this. On top of all of their supplements, their vitamin supplements, etc., and of course their meds as well.
Mhm.
Is it safe for someone who decides, I'm going to do away with all of my other supplements, my other calciums and zincs and, the vitamin Bs and Ds and everything else that goes with it.
Mhm.
I'm getting rid of all of that and I'm going to start on SeptoGuard. If and when I feel bloated or uncomfortable or have reflux, etc., then I'll use my gastrone on a needs basis. And the liver tib I'm going to use because I suffer from anorexia or, um, you know, uh,
Just
alcoholic liver
generally,
disease. Can I take all three continuously on top of the black seed that I take on a daily basis?
yes, you can. You can. With regards to getting rid of your entire cabinet of vitamins, we wouldn't really advise that. Just because, I mean, sometimes you may have females who need the calcium because of osteoporosis or some bone disease. So yeah, so you will find that some people may need to continue their other vitamins, but you'll find that the range at Tibb Health is quite comprehensive, and head to toe we take care of you.
What about, you've just mentioned calcium now, and we women obviously need calcium supplements on a regular basis. Do you
Mhm.
have something like this in the tib range?
Not entirely. So the difference is in the tib range. If you had to look at any of our products, you will find that you won't find a certain amount of vitamin A, B, or C. You will be
Ah,
getting it from the ingredients, yes, because we don't extract what we need, and we use the entire plant, the entire root, and all of that. So in a roundabout way, yes, you'll be getting all those vitamins, but not necessarily exactly like how you would get 500 milligrams of calcium and all of that. But your black seed, comprehensive. That will take care of most things
on a continuous basis for the rest of my
100
life.
for the rest of your
Alhamdulillah,
life.
I definitely am going to start taking black seed. But
No,
one thing that's just what's popped out at me is I'm looking at the information on SeptoGuard, and I see it says something about Moringa antibacterial. And this takes me back to a couple of years when I interviewed someone who's been touting Moringa leaves in a huge way, even to
mm,
the point of saying that people who have substance abuse issues could be healed by, ingesting this moringa leaves or whatever formulation it comes in. And I
mm.
see that Septogard has moringa in the preparation.
Yes. I mean, moringa is essentially something we've been eating for years, but not really known what it is. I mean, I think in the Indian community, it's known as drumstick. So,
Oh, okay, okay,
so
okay.
that's moringa,
Okay,
and
I can't remember when last I've eaten it, with the old people not around any longer.
yes,
They used to actually prepare it for us, mom and mom-in-law and granny, etc. But they're not around, and I can't remember seeing moringa in the stores any longer, not
yeah,
in a while anyway.
yeah. So your moringa is known to be pretty much a superfood. It contains everything that you would need. And yeah, we use it quite extensively in most of our formulations as well.
Wow.
Obviously here it's used for antibacterial properties and antioxidant properties as well.
Wow, that is truly amazing. We do need to wrap up, but I'm going to hand over to you to add anything else that we need to know about these three wonderful products that we're talking about this morning, which is Livotib, Gastrone, and Septogard. We also touched very briefly on the black seed, which you have indicated that one could take that on a daily basis for optimal health. What else do you
Yes.
have to share with us before I let you go?
Um, no, I think we pretty much covered everything with regards to the three products. I think there definitely needs to be an increase in care for our liver, and Livotib is something that we really need to look into in terms of people looking after their liver. Because remember, you've only got one. I mean, contrary to popular belief, you've just got one liver. And it is responsible for so many different functions in the body. We trivialize it to just digestion and detox and everything, but it's involved in blood clotting. It's involved in there's over 400 different functions that the liver is
Wow.
involved in,
Mhm.
and very little care ever goes to it. And it is the filtration unit of the body, or one of the filtration units, the other being the kidney. And
Absolutely.
yeah, so major focus needs to be on the liver. And then our digestive system, we use it every day. So why not invest in it? Why not care for it the way we should? A silly thing is we actually use clove and ilachi and all of that in the preparation or in the formulation of gastron. But how often is it when we find cloves or ilachi in the food, we take it out?
True.
And that's all the stuff that aids in digestion, right?
Absolutely.
So yeah, and then obviously Septogard for the entire family, kiddies all the way up to adults, however old you want to be, works really well for crash going children, school going children, adults, everybody, the entire family.
Riyaaz, lovely talking with you today. I definitely am going to go out and start stocking up on all of these wonder products. That's all I can refer to them as. And I do hope we'll talk again soon about the other amazing range of products that you, as the corporate trainer at Tibb Health Sciences, is involved in. So soon. Have a wonderful Eid. Lovely talking with you. Keep us in your duas. And Assalamu alaikum to you.
Wa alaikum salam. Jazakallah. Eid Mubarak to everybody.
That was Riyaaz Khan. He is the corporate trainer at Tibb Health Sciences, talking about these amazing products, which was Septogard, Gastrone, and Liver Tibb. And for more information, I suggest you go to the Tibb website just to get more information, or you can give them a tinkle, and I'm sure they'll refer you to someone like Riyaaz. That's it from me for today on the Mid Morning Talk Show. Do hope you've enjoyed all of the discussions we've had on air. And of course, as you also know, this is the last of the Mid Morning Talk Show with me, Julie Alli, in the month of Ramadan. As of next week, I go back to my old slot of the current news program, which is News and Views. So I do hope you'll join me then from 8 o'clock in the morning till 10 o'clock every Monday, Tuesdays, and Wednesdays. News and Views with me, Julie Alli. Till then, all we can say is shukr alhamdulillah to Allah subhanahu wa ta'ala for blessing us with such a Mubarak month of Ramadan, for bringing our families close to us, for being for just showering us with love, with muhabbat, with rizq, with barakah, and also the blessings of Laylatul Qadr. Have a wonderful Eid with your loved ones. Till we meet again, as always, Assalamu alaikum and Khudafiz from me, Julie Alli. Not forgetting my two favorite people, Muhammad Abrar and Shazia, who managed, obviously the one is the producer, the other one is behind the controls. So thank you guys. Have a great one. Assalamu alaikum.